Hi, my name is Jeffrey Zamora. I'm the president of SCOHRE Costa Rica, the president of ARDT Iberoamerica, the director of social media and audiovisual producer for INCO, and the project leader for the Veritas study of SCOHRE. Today, we're going to be talking a little bit about the situation of ARDT members when it comes to their smoking prevalence and the accessibility of harm reduction products. ARDT Iberoamerica, it's an alliance of consumer organizations, which its members are countries from Latin America, Spain, and Portugal. United by our language and a genuine desire to improve public health strategies that guarantee access to scientifically proven harm reduction alternatives for adults who are unable or unwilling to quit smoking. First of all, ARDT Iberoamerica has countries in every situation when it comes to regulation. We have countries like Peru and Colombia, which currently have no regulation when it comes to tobacco harm reduction products. We know that in Peru's Congress, there's a bill that has been discussed to effectively regulate these products, and we're hoping good news from that. On the other hand, we have Argentina, Mexico, Brazil, and Uruguay, who currently make it illegal to commercialize nicotine vaping products, but in Uruguay and Brazil, it is available legally heated tobacco products. However, it is important to mention that considering only the ARDT members, the countries that currently have the most considerable prevalence of use of nicotine vaping devices are Brazil, with an estimated 6 million users of these products, Mexico with 1.8 million, and Argentina with around 1 million people using these products. As previously said, meaning that all of the users of these products are accessing them through the illicit sources, bringing to the table evidence that, as seen in other latitudes and in other substances, prohibition is not working, is not eradicating the demand of safer alternatives to smoking. Said in different conferences like La Semana Psicoactiva in Colombia, the prohibition of products with demand does not miraculously eliminate it. And what it does is to prohibit a safer supply of the products by being unable to guarantee a proper regulation of manufacturing and distribution. Panama used to ban vaping devices, still with a lot of effort and work from the consumer organization there that is called ARDTP, and like-minded journalists and other organizations, they were able to challenge the government directive that prohibited the sale of these products. The court has decided that the ban is unconstitutional, reasoning why products are available to be sold in this country now. In other countries of the region, nicotine vaping and heated tobacco products are regulated, such as in the case of Costa Rica, Paraguay, Ecuador, and recently Chile. Whatsoever, Chilean health authorities are still pending to publish the regulation of the now approved law, which enables the commercialization of nicotine vaping devices. Such regulation is not impeccable in any other countries and can be improved to better guarantee that such harm reduction products are accessible and affordable for adults. Ecuador currently has a 150% tax on everything related to nicotine vaping devices, which provokes that these products are more challenging to be used by the people who need them the most, as well as making people reaching the illicit market to save money or simply being able to afford them. Currently, the countries with an organization member of ARDT Iberoamerica, which has the highest general prevalence of smoking, is Chile, with 29.2%, followed by Portugal with 25.2%, and Spain with a 27.7%, and Argentina with 24.5%. But it's important to see how the decrease in the prevalence of smoking during the past 10 years has flattened a bit, which is a massive predicament to our public health and what constitutes the need to look for different approaches to inform adults who are unable or unwilling to quit smoking of the health benefits of transitioning to vastly safer ways of consuming nicotine. As proven by the Cochrane Review, the data of ASH UK, the Ministry of Health of New Zealand, in France, and some others, I'm trying to mention just a few. But nicotine vaping has been proven to be effective to help adults quit smoking, and other countries such as Sweden has proven the same with snus and nicotine pouches and heated tobacco products in Japan. Just in Latin America, almost 49 million people who smoke are being denied access to proven effective harm reduction products legally, and close to 9 million people who currently use nicotine vaping devices are forced to do so through illicit sources. As has been said before, provision of harm reduction alternatives only favors people dedicated to earning money through illegal markets. And that way we cannot make sure that these products are only accessed by adults. And we cannot guarantee the quality of the ingredients and manufacture in that case. Tobacco harm reduction is a critical and pressing issue for our countries, as many of our nations continue to grapple with high rates of smoking prevalence and related health burdens. Implementing harm reduction strategies is crucial for addressing the public health challenges associated with smoking. This approach aligns with the goals of public health by striving to minimize the devastating impact of smoking on individuals and communities. Furthermore, tobacco harm reduction is important for reducing the stigma associated with smoking. In many societies, smoking is deeply stigmatized, often leading to social exclusion and barriers to seeking support for smoking cessation. Embracing harm reduction as a part of tobacco control efforts can help mitigate its stigma by offering pragmatic solutions that meet people who smoke where they are in their combustible tobacco use journey. This approach can foster a more supportive and understanding environment for individuals struggling with dependence. It is crucial to acknowledge the significance of harm reduction alternatives. As proven with harm reduction for the other substances, these strategies place a strong emphasis on saving lives, improving public safety, and lessening the society's stigma surrounding different substances, in this case, nicotine. By understanding the intricate nature of substance use and dependence and offering practical solutions, harm reduction strategies help bring tangible advantages for individuals, families, and communities. Embracing harm reduction as a fundamental aspect of health policy has the potential to foster healthier and more supportive societies for everyone. Thank you very much.